with her and see, what can we do as a society and what don't we know, and we need to be educated on. Dr. Joseph, good evening. Welcome to Phoenix Free Press.
Good evening.
Thank you, Dr. Joseph. If you can tell our audience a little bit about yourself. I know I read a little bit about your bio. Those who will see our live now and even afterwards will, some might be familiar with you and some might not. So I want to give you an opportunity to, give us an introduction of yourself.
Well, I don't want to take up too much time making it about me. What you spoke of was pretty much my education, but I was born and raised in Antigua. My family hails from Bendals. I have several brothers. I'm close with my family. I enjoy the beach. I love island life. I moved back to Antigua a little over 2 years ago to bring mental health care to Antigua. It's been an uphill struggle, which I expected, but it's been a bit more difficult than I really anticipated. All that being said, I don't regret coming back to Antigua. I'll continue to provide the service until I'm unable to.
So I'll let you tell us that uphill battle. Just give us a little overview of, your journey. You came to Antigua. You've seen what the service is like being offered where you were. And you say, you know what, this is my island, this is our home, and this is why we go away to learn and to see on the outside and bring it back home and, better our home and our environment. And you came back to Antigua. Give us that journey, not necessarily the dates, but those key things, that you experience, and just walk us through.
Sure. So I came back early October 2021. I did come back with a plan to provide services at the Sir Lester Bird Medical Center. This was originally along with discussions with individuals at the Ministry of Health. The plan was to add mental health services at that facility. There was also, or still is rather, difficulty in terms of patient transfer between Mount St. John's and Clearview. So the hope was that my presence at Mount St. John's could sort of bridge, make that a smoother transition. I worked at the Sir Lester Bird Medical Center for about a year, and then I resigned. The reasons are multiple. Based on being told that I am to practice mental health at the hospital, I requested certain things, basic things, in order to do that. Rooms to admit people, to treat them at the hospital, medications in the hospital. So if there's an emergency, someone who's psychotic, manic, I can just treat. I drafted up a protocol for the emergency room because individuals show up, they can be aggressive. Sometimes individuals come with weapons. So a protocol is usually in place from the time an individual hits the emergency room all the way until they're discharged from the hospital, whether they go to the ward or not. Everything I asked for, including even a clinic to see individuals from the public at the hospital, was denied. When I asked for a clinic, I was told no, there will be no clinic with mental health in the title. There was a fear that Clearview would dump their patients at Sir Lester Bird Medical Center in my clinic. I asked for medications to be in the pharmacy readily available. That was met with a no as well. The emergency room protocol, even though I drafted it up, it just needed review and approval. That was met with aggression. And when I asked for 2 rooms, I wanted a room with 1 bed capacity and another with 2 bed capacity. So 2 rooms, 3 beds, so that somebody comes to the emergency room, I can admit them, treat them, 2-3 days, discharge. I was told that hospital beds will not be tied up for mental health. This was back in January of 2022. And the reason I was given is that there's no money and COVID. And so I did my best to try to still address mental health as people would show up to the hospital despite my hands being tied. But what pushed me over the edge was that an individual would come to the emergency room for mental health issues. I would not be called, even though I worked there. They would give them my private office number and tell them, call and make an appointment. And when the person calls me, the first question they ask is, how much do you charge? And when I tell them, I get cussed, my mother get cussed, my grandmother get cussed, how I lie and I thief, and I'm trying to scam poor people, and I was up hospital, why you didn't come and see me? And even though I tried to explain, I did not know you were at the hospital. This is my first time hearing of you. I'm being painted as if I'm trying to divert people from the hospital to my private practice, I guess for my financial gain. And so in the frustration of not getting what I need to do a proper job, and the actions at the hospital are painting me in this very negative light, I resigned. So I've had my private practice since I came to Antigua. So in a little over 2 years now, I have a private office. It's in Upper Gambles, and I've been putting my focus there. It's appointments only because of the limited resources. I really can't accommodate walk-ins. I try my best to make sure the time is utilized efficiently. Unfortunately, people will make an appointment and then not show. And so that's a spot somebody could have used. I'm trying to minimize those, but my efforts right now are primarily through my office. The other things I've done since I've been in Antigua, which I'm not sure if you know, but the government refers to mental health or mental illness as certified lunacy. If you read the Medical Benefits Act, or if you go on the medical benefits page, the conditions that they cover, mental illness is represented as certified lunacy, psychoses, and other disorders. And so in July of last year, I wrote a letter, met with the head of medical benefits, because on the claims form, when they asked for the nature of illness, they would want me to put certified lunacy, and I refused. I've been board certified in psychiatry since 2017, but even through my training, I've never certified a lunatic in my entire career, and I'm not going to do it here. So I went to him with a letter explaining why this is inappropriate and that it should be changed. I have not gotten a word back.
Who him? Just to correct.
It's the chairman of medical benefits. I believe he's a senator. I'm horrible with names. I would not be able to tell you his name.
That's fine.
The other things I've tried to do, I submitted several times to medical benefits to update their formulary in terms of mental health medications. This is to include medications that are available in Antigua at the private pharmacies. So it's not that it's completely new to Antigua, they'd have to bring it in, order it completely foreign. Other pharmacies are able to bring these medications. I wanted them available to people who subscribe to medical benefits, because majority of the individuals with mental illness are in the mid to lower financial class. Mm-hmm. So if you have to find money for appointments, then have money to buy the medication, it creates an environment where it's easy to compromise. Either I don't go or I don't buy the pills, and this is how people, they get better for a while and then they go backwards. I've tried at least 3 times with medical benefits since 2019, and it's repetitive excuses. We haven't had the meeting yet, or we've already met and you didn't turn it in time. The last thing I heard is that we'll keep it on file for the next meeting. I don't know if they've had a meeting because nobody has communicated with me since. And that was over a year ago. So my efforts have been through my private practice and out of my own pocket. For May being Mental Health Awareness Month, I typically put up billboards across the island with my contact number. I do the same thing in September for Suicide Prevention Month. I'm often on media, ABS, Observer, Nice FM, just providing basic information. My goal is to reduce the stigma in mental health. There's a stigma across the globe, but in the Caribbean, it's particularly thick. Because although we have smartphones and fiber optic cable, we have an advance in terms of the way we think. We still look at mental health as something to be ridiculed or something to hide away. Whereas in first world countries, they're walking around with their antidepressants, taking it over lunch as if it's not a big deal. And I don't expect us to get to that point, yes. But we need to stop hiding in shame, because unfortunately it ends to loss of life. And then it's, what could we have done? And so you want to intervene before it gets that far. So that's just a little bit of all that I've tried to do in a little over 2 years. I believe that people are learning about mental health. I can see it in the number of people calling for appointments, calling for advice. I think that it's working. It will take years. It'll probably take my entire career to get people to the place where you're readily seeking help. But the hiccup I'm having right now is people are seeking help, but the resources are very limited. There's one psychiatric hospital, getting in is difficult, and the facilities aren't the best. Mount St. John's has nothing to offer in terms of mental health. Medications are limited in terms of what's effective. There are some medications at medical benefits. I rarely use them, mostly because some of them have side effects. There are newer medications available, even in Antigua, that I believe should be at medical benefits. Why they are not, I can't answer that.
All right. You want to see? I said to you, go ahead and speak. You have your tea. Take a sip, man. You in this thing. You're in this thing, Dr. Joseph. You get it. Because I have all this, just scribble all over, like. Okay, so we're gonna take it piece by piece. So let's go back a little bit.
Sure.
You mentioned you asked about rooms and medication, and you provided a protocol for the emergency room. Let's talk about those. So the rooms and the medication, the rooms you were denied, and the type of medications, were they, like you mentioned earlier, more recent and more up to date, less side effects, that kind of stuff?
So the rooms were denied. The reason was there may be a COVID outbreak, and I'm not tying up hospital beds for mental health. Those were the exact words I was told. The medications I was requesting are actually at medical benefits. So what I was requesting is for those medications to be in the hospital. So let's say somebody shows up at 7 o'clock on a Friday night, I can get the medication to treat them. If it's at medical benefits, what I'm going to have to do is wait until Monday, write a prescription, call a family member to come get it, fill it at medical benefits and bring it back. Now imagine you have somebody who is psychotic or homicidal or suicidal, and they're just sitting in the hospital from Friday at 7 until at least Monday because it's not in the hospital.
All right. The protocol for the emergency room.
Mm-hmm.
You mentioned that you put it together. What happened? What happened with that?
So the protocol is, as I said, and this is what happens in the States. Usually the person is asked to remove their personal clothing, put on a hospital gown. Because as I mentioned, people come with weapons, knives hidden all over, for example. The other thing is if you see somebody in a hospital gown outside the hospital, you're likely to call the authorities and say, hey, this person may have gotten out of the hospital. There are medications that I wrote up for situations. If somebody is manic, give them this medication. If they're not sleeping, give them Y, etc., etc. I gave the protocol to the head of the emergency room to review, welcomed feedback to try to get it in place. But unfortunately, all of the physicians at the hospital are overwhelmed. Like myself, when I was there, they're operating with little or no resources, little or no staffing. And so all I got was frustration every time I asked about it on follow-up. So I just backed off. So that's how that went. It never got further than that.
All right. Clinic. You said the clinic was denied.
Because the belief is if there's a clinic at the hospital, Clearview will start dumping their patients in the mental health clinic at Sir Lester Bird Medical Center.
Can you explain that a little bit more for us and just give us a little bit more to understand?
So to be honest, I don't quite understand. The individuals at Clearview are hospitalized. So they're confined, they have to stay there. Why Clearview would send them to Sir Lester Bird to my clinic, I have no idea. But that was the reason I was given as to why there will not be a clinic with mental health in the title. That's how it was phrased specifically.
Is there a mental health crisis in Antigua and Barbuda?
Yes, there is.
How bad is it?
It is on a scale of 1 to 10, 10 being the worst, we're at about an 8. And it's across all ages. So I think one of the last calls I got to my office yesterday was about a mother calling about her teenage son who had attempted suicide. I get a lot of calls about children having suicidal thoughts, poor performance at school, behaviors that are just out of the normal. I'm getting calls all the way up to the elderly with dementia, aggressive behavior, wandering away. They're starting to hallucinate. They're delusional. So a lot of these people need to be hospitalized, treated, and then once they're better, they can go home and follow somebody in a clinic. But unfortunately, I just have a clinic, an office setting. I have nowhere to hospitalize anyone. So the only option would be Clearview for individuals who are really, really sick.
I'll take a sip too. You're saying to me, Dr. Joseph, you're saying to me, Dr. CHENELLE Joseph, you're saying to me that mental health crisis in Antigua and Barbuda is at an 8. The calls that you're receiving is all ages.
Mm-hmm.
A lot of young people are considering suicide. I just want to ask you a question. Have you been following the news to know that we've knighted the Minister of Health? I don't know if you don't have to say, I just know if you follow the news.
Occasionally.
Yes.
I think I heard that he was knighted, yes.
Okay. Can we talk a little bit about Clearview? Have you had any interactions with Clearview? Have you had any of your patients, whether private patients or patients from the hospital, needing a reference to Clearview or anything like that?
So I personally have been up to Clearview twice. Both were last year. I haven't been this year. I have had clients who have had to go to Clearview because, as I said, there's some people that need to be hospitalized and watched as they're medicated before they can be safe in the public or at home. The difficulty in getting patients to Clearview, even as a psychiatrist, again, on a scale of 1 to 10, I'd put it at an 8. The reasons being, most of the time I'm told that they're full. There are no beds available.
At Clearview?
At Clearview.
Okay.
Other times there's a medical set of tests that Clearview would like done to show that somebody is medically fit to be at the facility. Some of those tests have to be done privately because the machine either doesn't exist at the hospital, or sometimes if it is, it's not working. And so, as I mentioned before, with individuals being in the mid to lower financial class, it's sometimes very difficult to get all of these tests done. So sometimes they are not able to be admitted because tests are not done yet. Sometimes they're so aggressive. So one of the tests is a CT scan of your head. You have to lie perfectly still for that. If you're hallucinating and paranoid and manic, sometimes it's extremely difficult just to get that one test. So there are some people who have been able to get in, but for the most part, I've had difficulty getting my clients into Clearview.
But you've been able to get clients into Clearview?
Eventually.
Okay. Are you able to see them? Well, you did say that you've been there twice. When they check into Clearview, what happens next?
That I don't know. So I don't work at Clearview. When I went the first time, the staff was generous enough to give me a tour of the compound.
Okay.
But in terms of my clients, once they get there, I'm not familiar with the process.
Okay. But in that tour that you did, and for your knowledge and all the need that you see across Antigua and Barbuda, and this Clearview issue being very serious because of now the death of Latifah George, and still there's no answer on what caused her death. You've been there, you walked through a year ago, you're familiar on what is needed and what is necessary, like really necessary. Do you see it? Don't you see it? What? Just talk to us.
Well, I see it. I understand that when it was then Mount St. John's was being built, it was recommended to have mental health beds built into the facility. For reasons I'm not aware of, that wasn't done. I understand that our grandparents' days, it was common for the medical hospital and the mental hospital to be separate. However, in 2023, almost 2024, in developed countries, mental health is managed in the medical hospital. It's not in a separate facility locked away behind high trees and high walls. It's incorporated, so your mental health clinic is next to your medicine clinic, your eye clinic, your kidney clinic. It's not an isolated part of medicine. So that was one thing that stuck out to me. The other thing is, unfortunately, we still have a modern day asylum. We have wards where individuals are just housed, they're living there day in, day out. They get their medications. The tour that I saw, there were several people just lying in bed, and you can tell that's just what they did all day. Very little physical activity, very low stimulation. There's nothing in terms of rehabilitation to reintroduce into society, which is what mental health care is in the rest of the world. So there is a lot that needs to be done. The actual facilities there, even if you want to say, well, those buildings are all we have, the physical buildings are deplorable. I think the second time I went, there was only 4 functioning toilets. Clearview houses, I think 120 to 130 people. And then you have the staff. So it's, I think at one point I heard in the news they were building latrines or something. So
Using concrete slabs.
yes, the facilities themselves need to be, even if you need to say it has to be separate, you could at least build it up. Some of these things haven't been redone, refurbished since they were built initially. It's just a paint to coat every now and then and move on. So I throw my voice with the staff at Clearview, and I applaud them because they are spinning straw into gold every day. They are trying to treat individuals, help individuals who can't help themselves with little to no resources being given to them. Yeah. And so I throw my voice in support that something needs to be done in that regard.
All right. So, Dr. Joseph, you're not going, you did say you have some time. You do have your tea. If you need to freshen up your tea, I'll definitely encourage you to do that, because our next guest is here. Martin is here. We're going to be talking about the environment. But before I do that, I see that our audience have their questions, and this is an interactive platform, and I definitely have to share. They're here. They allow me to be here. They allow us to be here. Okay. So we have to ask their questions. So let me go through the questions and share them. 1 second. How many beds are at Clearview?
So I believe it's between 120 and 130. But from what I was told when I actually went on one of the tours, they usually have a little bit more than that. Usually they're fully booked.
Okay. This one says, Doc, what do you think is contributing to these young people becoming mentally ill? Is it stress, drugs, or finance?
What is behind mental illness? It's usually not just one thing, whether it's child or adults, but I'll speak on the children. I think it has to do with the environment that they're in. Most children are spending too much time on devices, social media, and its many platforms. And so they're getting poor self-image, poor self-esteem. Some people are being bullied online, and things like that can push our young people to think they're better off dead. Financial stress in the home can affect the children. Even if you think you're shielding them as best as you can, their children are smarter than we give them credit for. They can pick up on what is going on. For some children, if there's a parent that's missing, especially if the father is not as involved or missing, our young people will seek that out and find it in the wrong places, especially our young boys. So this is where the gangs come in, dealing drugs, using drugs. I tell people all the time, I am not against marijuana. It has its uses, even in mental health. However, marijuana is being genetically altered to enhance the part of it that makes you high. And unfortunately, too much of that can make you psychotic. It can make you manic. It can permanently damage your ability to process and think. Mm-hmm. The other thing is, and the testing isn't being done in Antigua, but things are being put in the marijuana. And I believe my idiot thought on this is that since they decriminalized it where everybody can grow their own, the dealers have to get you to come back to buy from them. Mm-hmm. So they're going to lace it with things that they think are going to keep you coming back. And unfortunately, especially in a young brain that's still developing, hormones all over the place, it can be easy for that to swing you into a mental illness. So I believe
Well,
what's going on with our young people is multifold. Whatever your views are on marijuana, I think we can all agree that children should not be smoking. And so we need to address what's going on with our children at multiple levels, in the home, at the school, in the churches. We all have a role to play.
certainly. And the big bombshell. Talk about July 27, 2022, Doc, the day you were summoned to Clearview. Tell the public, Jack, don't hold back.
Um, July 27th, 2022. Summoned to, I was
Clearview.
summoned to Clearview.
Look at right here, Jack. Look at right here. Doc, look at right here.
I don't know what that. The only time I went to Clearview in the second time I should say, I was called to a meeting because I was writing medical reports, assisting families to get the court order for people to go to Clearview. I was called to a meeting and I was essentially told, unless someone is suicidal or homicidal, that they should not be sent to Clearview, and that no one sent by me with a court order will be admitted. I was told because then Clearview will be sued. I do not know how, but that is the reason I was told. So
Can
that
I
is
explain
the.
that to us? I don't understand. We don't understand that.
I don't understand either. I was just told, unless somebody is suicidal or homicidal, they would not be admitted to Clearview. And if I might write my report, the family take it, get the court order, Clearview will not take anyone sent by me with a court order because Clearview would be sued. I do not know how. So from that point on, I stopped. I was under the impression I was doing the hard work, getting the court order in place so that they could admit, but it seemed like they were not happy with that. So from then on, I stopped doing it.
And one more question here before we jump over to Martin. So when you refer your patients, don't you do any follow-up? If no, why?
So usually when I see my patients, especially if I prescribe a medication, I follow up within a month, 6 months, 6 weeks the latest. But if somebody goes to Clearview, usually their follow-up is with Clearview moving forward. Typically, you don't want two psychiatrists. People practice differently. What I might want to add, somebody else might want to increase something else. So it's better to have your care under one provider. So if it's a case where somebody who's seen me goes to Clearview, their care from that point onwards is through Clearview.
Okay. And I just want a little bit of your input on this situation with regards to Latifah George. Whatever you can share, I don't know, whatever you can share just to give us something. I know you might have read it in the newspaper, anything.
Well, I read it in the newspaper. Actually wasn't even on island when the story broke. So all I really know is what is in the newspaper. All I can say is my condolences to the family. It's unfortunate. She was very young, still had all of her life ahead of her. I hope they can get answers soon, but I have no additional information outside of what was in the news.
Perfect. Perfect. Thank you, Dr. Don't go anywhere, Dr. Joseph. You take a sip, but I'm just going to remove it from the platform so I can add